topic is the principles of social value. We're going to be exploring the 7 principles of social value. And hopefully by the end of this 1.5 hours together, you'll have a really strong understanding of those 7 principles and some understanding of whether you'd like to apply them in your work and how you might do so. At the end of the session, you won't be an expert on the social value principles or social value measurement because we only have an 1.5-hour seminar together. And as everyone knows, to become an expert, you need 2 1.5-hour seminars on the topic. So why do we have principles, or why should we use principles? So there's a lot of different definitions of principles. It means different things in science, administration, ethics, metaphysics. You know, people use the term principles. There's a lot of different definitions. Now, I've put a reference there for one set of definitions, not because I think it's particularly useful. I just wanted to highlight the title of that journal paper and kudos on the author for the title. For the purposes of our, I guess, discussion tonight, the definition I want to use is probably one that people are familiar with when they think of principles, and this is adapted from Michael Quinn-Patton's work on principles-focused evaluation. So it's the idea that we have a set of ground rules for engaging with a wide variety of situations. The idea is that at any one time, no matter our role, no matter our organization, we are limited individuals dealing with limited information, trying to make decisions, often quite complex decisions for quite complex problems. So what principles do is that they inform those choices at the forks in a road. They provide direction, but not prescription. So they'll never give you the specific action or the final answer, but they help provide some consistency around your decision making and help provide a rudder for navigating those complex dynamic systems. So I really think that in any professional practice, you're obviously going to have rules and you're going to have methodologies and you should follow them, but you should also retain that flexibility and responsiveness to have a set of principles. And so today we're going to talk through the 7 principles of social value. Now, where did these principles come from? Well, they've been developed by Social Value International, which is the global network that's focused on social impact measurement and social value measurement. It grew out of the social return on investment methodology in the UK, and it was the sort of governing body for that in the late 1990s, early 2000s. There is a member network here that I would recommend to anyone who's interested in learning a bit more about. That's SIMNA. And Social Value International overall is involved with managing standards and methodology, assurance and accreditation of people who want to measure the social value or produce social value reports, and they provide a whole lot of training and support. So the principles we're going to work through today are available at that link down the bottom of the page, and all the content here is obviously Social Value International's content. I am a practitioner in social value. I've done training for them. So I'm going to use their content, but obviously colored with my own experience and examples. So I'll just preface this by saying that if there's anything in the content that you disagree with or find objectionable, it's social value's fault. But if there's any of the content you really enjoy, it's probably fine. So before we sort of move on into the principles themselves, I just want to make this, I guess, the definition and provide a bit of a glossary in terms of what we talk about when we mention social value. So this was referenced in the overview or the sort of the ad for the webinar itself. But the way they define it is that social value is the value that stakeholders experience through changes in their lives caused by activities, programs, decisions. And we know that some, but not all of this value is captured in market prices. So as evaluators or people involved in programs that deliver outcomes, we know that there is such a thing as social outcomes. So the idea that, you know, people's well-being benefits, employability benefits, family relationships, social relationships, confidence, self-esteem, all of those things are social outcomes that are worth something for someone. So when we talk about social outcomes, we're talking about the changes. Those will be unintended, intended, positive, negative. Social value takes it a step further by trying to quantify the relative importance that people place on those changes. So it's about saying we experience a change, but it's worth more to X person than it is to Y person, or X group compared to Y group. So that's a bit of the, I guess, nomenclature as we progress through these slides. And a really, I mean, a classic example of that, and probably a cruel example at this time, but you know, we might buy a flight to go on a holiday, and we might book a hotel, and we might spend $1,000 on all of that. but the holiday itself is worth more to us than just that market price of the flight and the hotel. So if we are trying to work out what social value is, or the social value of an intervention or an organization, an initiative, what information do we need to account for this? A lot of this is the stuff that we're familiar with as evaluators. So we might ask questions like, well, who changes or who benefits as a result of the activities of that initiative? How did they change? Which changes are important? And when we start to work down this list, that's when we start talking about social value. So how much change was there? How long did it last? How much is it valued by those individuals or by that stakeholder group? And how much is down to us, that sort of contribution, attribution aspect? And what social value principles and the sort of framework around social value measurement does is help give us a framework to say, well, who decides? Who decides the answers to these questions? Who decides the questions that we ask? And how much rigor do we need at each of these stages? And that's about the amount of information or the level of rigor that's required to make decisions at different times. So whether you're doing a planning for a pilot that you might roll out, the level of rigor you might need and the level of, or the detail of information you might need is very different to if you've got a $100 million program that you're trying to roll out nationally. So all of that depends on judgment calls. And again, in the ad for the webinar, we made the point that evaluators are excellent at making judgment calls and dealing with judgments and dealing with subjective information and coming to a decision. So it's no different with social value, and we're going to make judgment calls, and they will be subjective and they will not be absolute, but they will be vaguely right. And there's a quote there that's often attributed to the British economist John Maynard Keynes, but is actually from somebody else, which is ironic given the vaguely right, precisely wrong quote. But the quote itself is that it is better to be vaguely right than precisely wrong. So making subjective judgments is sometimes vaguely right, but the alternative, which is to ignore social value altogether and risk leaving it out of decision making, is precisely wrong. So we know that the range of judgment for social accounting or social value and accounting for social value is quite wide. The range of judgment involved in financial accounting is the narrower one there. Now, we know that that's not because financial accounting is done in a lab, it's just that it's had 300-400 years of standardization. It started off as this idea that's, we need to account for the financial value of an enterprise. So how do we do that? Someone came up with accounting and came up with this sort of early standards for corporate statements and financial statements, and they built up that over time. And we've moved from what we think is basic accounting, revenue, expenses, balance sheets, to really starting to think about intangibles now, goodwill, reputation. All of those things are quite sophisticated and, again, not measurable in a lab, but they're well understood in financial accounting. Similarly, over the last 30-40 years, it's become commonplace to value environmental goods and services. So what is the value of a wetland? What is the value of a greenhouse gas emission? All of these things have been brought into standard financial decision-making or economic decision-making. And there's no reason that social outcomes can't, over time, narrow that judgment field and become part of that conversation as well. So to guide those judgments, I think we need principles. And that's what the social value principles, or why the social value principles have been developed, so that we can create a consistent, credible account of the value that's being created or destroyed by an initiative, by a program, and create an account that recognizes that the level of rigor required depends on the needs of the audience and the decisions that will be taken. So what the principles do is provide a sort of roadmap that can be applied universally, while the outcomes themselves and the way they're measured and what they're worth to people remain specific to the context or to your particular organization. So what are the 7 principles of social value? So anyone who might have read ahead might have seen these, but there are 7 of these. Number 1, involve stakeholders. Number 2, understand what changes. Number 3, value the outcomes that matter. Number 4, only include what is material. Do not overclaim, be transparent, and verify the result. Nothing groundbreaking there, but just a sort of pithy set of ground rules that we can use when we are doing our measurement work, when we are doing our evaluation work. So the first 5 of those are really that analysis component. So it's what you do when you are conducting your analysis or your measurement. Whereas the second 2 are much more about the reporting. So what do you actually report once you've completed your evaluation? So like any good evaluator, I'm interested in some data. I'm interested in some feedback on this presentation itself and what you sort of get out of this seminar. So I'm going to put up a couple of polls here at the start of the session. Hopefully those on tablets or phones can also see this. But this is just a live poll. So I've got a link right up the top there, pollev.com/TS723. If you'd be so kind as to go into a different window and just go to that website or that link, you'll be able to respond to that. So the question there is, which of these principles do you think you consider or apply in your work regularly? Once you're on that link, you should be able to respond to those. So if everyone could take a few seconds now just to do that, that'd be great. Okay, that's great. We're getting some results. You can obviously choose multiple principles. And as I'm doing this, I realize I should probably have named them there. I'm relying on your memories. But principle 1 is involve stakeholders. 2 is understand what changes. 3 is valuing what matters. 4 is about including what's material. 5 is about not overclaiming. And I haven't gone into any of these principles, so you're doing this based on, I guess, your best understanding of those, which is what I would like to know at this stage. Yeah, 6 is about being transparent, and 7 is about verifying the results. Excellent. I think we've got most people there, so I might move on at that point. Thank you all for doing that one. I've just got a second one that's probably putting myself on the spot a bit, but hopefully this one's come up. So you obviously are interested in learning about this. That's why you're here tonight, hopefully. But it'd just be great to get a sense of how everyone thinks this is going to help with their work based on what you've seen so far. All right. Thank you for that. I'm surprised. I thought evaluators would be more skeptical than that, so I put in the may not, but it's also vaguely, it's a vague sort of statement, so I get it. Okay, moving on with the presentation itself. So I've mentioned earlier that in any decision making, you're going to have different levels of rigor that are required. So depending on your objective, if you're at the planning stage of a program, you might apply less rigor than if you're publishing a public report or sending a report to a funder. So your level of rigor for decision making and the data requirements is going to vary based on your objectives. The good thing or the bad thing is that the principles apply regardless. So all 7 principles should apply no matter what stage you're doing your evaluation work, or not at what stage you're delivering an initiative, or what level of reporting you're doing alongside that. So I just want to reiterate that point. that the whole point about principles is that they should apply universally and throughout, and they should help guide your decision making. So let's get into the principles. Principle 1, involving stakeholders. So the technical definition there, or the definition provided by Social Value International for this principle, is inform what gets measured and how this is measured and valued in an account of social value by involving stakeholders. So again, just a bit of definition and glossary. I think everyone's familiar with the term now, but stakeholders are any actors that have contributed to or been affected by your program or service. So they contribute to the change, so possibly on the funding side or the delivery side, or the experience change as a beneficiary, as a sort of secondary beneficiary of some program. It doesn't have to be individuals. It can be different tiers of government. It can be the environment. All of those are stakeholders of a particular program. There's a two-stage process to involve stakeholders. Again, this is not particularly new to any evaluation people, but the idea is to map your stakeholders, to figure out who you should be consulting, and then obviously to engage with them through various forms of qualitative research. So just to work through a really simple example so that I can take us through some of the principles. I've put together a really brief map here of a community housing program in New South Wales that I evaluated a few years ago. And you can see down the sort of bottom middle in blue, you've got the community housing provider themselves, and then spread around them are the various stakeholders that we found out. So at the bottom left, you've got the partner agencies, so health, education departments, or service providers that they work with, the customers of the community housing itself, their families and friends, their employers and educators. At the top right, you've got the funder, the Department of Families and Community Services, and some other sort of philanthropic and corporate partners of them. And you've also got some sort of local residents, councils, schools, community groups that might be interested. So we went through this process with the community housing provider, and we worked out, well, who do we take forward to engage with? And we picked these, the community housing customers themselves, the partner agencies, and the department. Now, there's multiple ways to make that judgment. You know, one could be resources, not the best one, but often that's a very salient one. The other principle that comes into play here is including who you think is material, or those who you think will be materially affected by your program. And I'll get to that in principle 4. But just to make the point that you have to, at some point, obviously, decide who to take forward. So once you've identified those groups, you'll have some key questions that you want to talk to them about. And this is mostly standard evaluation style questions. So what has changed as a result of being involved with the program? Question 2 is probably a little bit different. It's more social value specific. So what are those changes worth to you? How important are they? What aspects of the program contributed to those changes? Do you think anyone else has experienced any changes that might help you identify some sort of secondary stakeholders or others that you need to include? What do you think would have happened if you hadn't been involved with the program? Who else provides a program like this? How can the program be improved? So obviously these don't need to be asked verbatim, but these are the sort of questions we're trying to answer as we go along doing our social value measurement work. And I think, again, this just reminds us that in evaluation, we write reports, we do analysis, we come up with frameworks, we come up with tables and charts, but the core of our work and the core of social value measurement is just listening to people and understanding what changes and what matters from their perspective. And that leads us nicely into principle 2, which is understand what changes. So how change is created, and gathering evidence to recognize that this has happened. The way we often do it, and social value measurement practitioners do it, is to assemble a program logic or a theory of change or something similar that basically sets out the chain of events or the sort of causal links between what you have set out to do, what resources you've mobilized, what activities you're taking, and the outputs and the outcomes of a particular program or initiative. So again, I know this is probably completely familiar to a lot of the people on the call, but just to walk through the same community housing example. So once we had identified community housing customers, partner agencies, and funders, we spoke to them, we gathered the evidence, and we put together a simplified sort of theory of change program logic for them. So on the left, you've got the inputs, then you've got what they did, which is provide access to newly built housing, 80 new units. The staff at the community housing center conducted well-being visits to welcome people to the residences. They were They really prioritize responsive property maintenance, and they helped arrange local events and activities. As a result of that, you had a series of outcomes. The stakeholders or the customers experienced reduced stress about the housing situation. They knew someone was interested in their welfare. They felt that their issues were being addressed quite swiftly, and they had an opportunity for more social interactions. And as you followed that chain through, we identified 3 sort of long-term final outcomes that were occurring and that were in line with what the community housing provider was trying to contribute towards: a sense of security, a more positive outlook for the future, and a sense of belonging and inclusion. So again, not unfamiliar to anyone who's done evaluation work or who's put together a theory of change, but the idea is to sort of identify that pathway and figure out what those long-term final outcomes are, so that once you've decided on what you want to focus on, you then work out how to measure that, and you can also work out how to value them. So principle 3, which is value the outcomes that matter. So the definition there talks about making decisions about allocating resources between different options, and that needs to recognize the values of stakeholders. So value, again, social value refers to that relative importance of different outcomes, and it should be informed by stakeholder preferences. So when we speak about value, it's identifying the relative importance, and the term valuation is the method that we're going to do to determine that relative importance. And the idea here is that you can reveal, identify, measure relative importance, and use that to compare what's happening for different stakeholder groups without at any time having to generalize or average out amongst them, because you're using their perspective to do that. And what that does is it helps improve how choices between options are made, allowing resources to be allocated to increase people's well-being, which is generally what most of these programs are about at a broad sense. We're going to spend a little bit more time on this particular principle because I think that this is probably newer than the first two. So I'll talk through this a little bit more. But the one thing I want to leave you with is that whatever methodology you choose to do this evaluation, the value should really be from the perspective of your stakeholder. So this is not what the funder is saying they wish was happening. This is not the funder or the program managers or staff saying what we think should happen. This is about the stakeholders themselves. Now, in impact measurement, social value measurement, evaluation work, we often use outcomes and indicators. So we talk about, we think there's an outcome, a sense of inclusion or belonging. We pick a couple of indicators, we measure that, we determine if it's been, if that outcome's been achieved and to what extent. Now, where social value takes this a bit further is adding this concept of value in relative importance. So if we take an example, a really simple example, and we say, okay, we've got 3 outcomes, outcome A, outcome B, outcome C. We know after gathering data that there's been a positive change in outcome A, there's been a positive change in outcome B, there's been a negative change in outcome C. Our measurement is fairly sophisticated, and we've measured how much change there's been. So we know there's been 40 units of change, positive change in outcome A, there's been 60 units of positive change in outcome B, but there's been 20 negative units of change in outcome C. So at a net result, there's 80 positive units of change, whatever that might be. It might be a number of people who've experienced the change, it might be on a scale, but we know there's been a positive change of 80. Now, at this stage, we think, okay, well, the program's good. It's got 2 positive outcomes, 1 negative outcome. The negative outcome has been experienced by fewer people or to a lesser extent. It's a good program. Now, what if we knew that the value that people placed on those outcomes, how much it affected them, or how important it was for them, looked like this? A and B were similar at 10, C was 100, so 10 times more valuable. Now, all of a sudden, the value of these outcomes looks a bit different. Now, this program is suggesting it's got a negative value of 1,000. At no point are we talking about dollars here or anything else. We're just talking about units of value. And so what that illustrates is that we need a way of assessing relative importance, and that can be monetary or non-monetary. So there are non-monetary techniques for working out relative importance, things like most significant change, multi-criteria decision-making, ranking methodologies, all of those look at that. Here we're going to focus a little bit on monetary techniques, and we use money simply as a unit of value because it's recognized, it's used all over the world, and it's a way to calibrate, compare, and communicate our findings. And hopefully, if you do it in that way, and depending on your sort of needs or your funder requirements or whoever it might be, it can often be a really good way to influence decision making in a positive sense and bring into the sort of analysis the voice of people and the perspective of those stakeholders in terms of what really matters to them. So with valuation, we've got a couple of different types. So there's cost-based methods. That's where you've got a real cost or a saving. Then the value is literally that cost or saving. So if you are doing a program that's changing people's government benefits or access to government benefits or is likely to increase their income, you can just incorporate that increase in benefits or increase in income. Where you don't have that and the value is not a real cost or saving with a market price, then you have to do that by reference to things that do have market price values. So the value-based methods. So something like decreased social isolation as an outcome is a really important one, but you can't buy social isolation off a market shelf. So you have to find another way to represent the value for that outcome for that individual. So there's a couple of methods. So cost-based methods, like I said, is just the actual cost or change in money or resources. So people might be familiar with the idea of a unit cost. You know, how much does it cost to put someone in the emergency department? How much does it cost to run a particular service? That's fairly straightforward. Value-based methods, there's a couple of different techniques. So there's the idea of stated preference. So it sounds like what it is. People actually tell you what they think they value that outcome as. Revealed preference, we use some other research and some data to work out what something is worth to people based on something else they do. And then there's the technique of life satisfaction and well-being valuation, which is gaining ground in the last couple of years. Again, I think mostly sort of propagated or promulgated through the UK, but it's starting to become more prominent in Australia as well. So I'll talk through a little bit about each of those value-based methods. So the first one is stated preference, and people might be familiar with the terms willingness to pay or willingness to avoid. So here's just a screenshot of a study which looked at willingness to pay to prevent Alzheimer's disease. So this study, researchers went out, they surveyed a large number of people, and that's what you normally need to do for these types of techniques. And they worked out down the sort of middle there that on average, people were willing to pay $155 per month to avoid getting Alzheimer's disease or to prevent Alzheimer's disease. So if you have a program that's looking at something similar, you could say, well, it's worth, over a year, $2,000 that people would value preventing this. So one of the challenges with these sort of studies is you do need a large amount of, you need a large sample size to account for individual variances and things like people having different amounts of income or people being higher at risk of Alzheimer's disease, for example. So often it's not plausible or feasible to do this as an evaluator or as a per program, but you will find research on this available and it might be useful as a starting point. The second technique is revealed preference. So this is where you use spending on other things to try and reveal what the value is for a particular outcome. So you could look at health insurance. Most of us spend some money on health insurance. Does that reveal the worth of peace of mind? Does the spend on security systems reveal what it's worth to feel safe in your home? Does the spend on sporting memberships or community classes reveal what it is worth to feel part of a community? Again, poignant sort of example at this stage about trying to feel part of a community, but these are the sort of things that you'd use in a revealed preference analysis. The last one I mentioned was life satisfaction and well-being valuation. So as I said, it's sort of gaining ground in Australia through the Australian Social Value Bank. So you can have a look at that. They've got a license model there for different values that you can then use based on the outcome that you have in your program. The way it works is that it uses a global measure of well-being, such as life satisfaction, and it works through large data sets that look at changes in life satisfaction across all Victorians or all Australians or whatever the group might be that you're interested in. And the most common survey sources for that, or the data sources for that, is the ABS, Australian Bureau of Statistics, and the HILDA survey that I think is carried out by Melbourne University annually or biannually. And HILDA is Household Income Labor Dynamics Survey, but HILDA survey. So the way it works is, for example, that survey might reveal that living in a safe area, by comparing people who live in unsafe areas, less safe areas, more safe areas, increases your life satisfaction by 1 index point. You then look at, well, what increase in income is needed to also increase life satisfaction by 1 point, and you find that it's $2,000. So people who earn $2,000 a year more are satisfied 1 point more. So then you compare those two and you say, well, the value of living in a safe area is equivalent to $2,000. So that's a really simplified way of putting it, but that's how that technique works. And you know, it's a fairly innovative way to do that, using existing data sets. And you can also drill down into your particular demographic if you're working with a particular demographic. The last technique I'll mention, because I'm going to use it in an example I'll give you in a second, is the idea of quality adjusted life years. And this is quite commonly used in health economics and in any proposals that are likely to save lives, for example, you know, changes to roads or road safety initiatives. So the way it works is that it's based on the numbers of years of life that would be added by an intervention. So a perfect year equals 1, death equals 0, and then everything is in between. And if a year isn't lived in full health, a weight is given to account for that. So for example, there's a weighting for generalized anxiety disorder of 0.017 or 0.17 or 17%. So that's basically saying that we think, based on, oh, not we, but health economists have decided that the impact of having general anxiety disorder sort of imposes a 17% weight or disability to your perfect life. And you then add that to this concept of what a life year is worth, which in Australia, they've done some research on this. And in case people didn't know, generally accepted figures for Australia are $213,000 for a life year. What that means is that's an estimate of society's value for a life year. So 213,000, basically a life in Australia is worth about 5 million, according to the Office of Best Practice Regulation from Treasury. So that's how they work these things out. So if an initiative is going to save an entire life, it counts as saving $4.9 million, I think is the right number. And if it's going to save a life year, it's the equivalent of saving $213,000. So if you use this health economics approach, what you can do is say, well, we've got $213,000 for a life year. We know that generalized anxiety imposes a sort of weight or disability of 17%. So the value of preventing or avoiding generalized anxiety disorder per year or per person year is $36,000. That's how this particular approach works. So I've gone through those fairly quickly. There's a lot more to it. Obviously, this is just focused on the principles. I didn't want to get into the methodology, but some of this might be new to people. So I thought I'd run through an example and get you to have a go at thinking about some of these things with financial proxies and evaluation. So I'm just going to share a link to a file in the chat. If I can make this work. So I've just put a link in there, and apologies for people who sort of can't juggle too many things at the moment if they're on their phone. But if you can open that chat window, download the file, and there's a brief note in there. And Charlie, if you could help me out here, we might put people into small groups for about 5 minutes just to talk through this, obviously talk through anything you've seen so far. And I'd just like you to, as a small group of 4 or 5 of you, try and pick the most appropriate proxy for the 2 outcomes in that file. So there's 2 outcomes about an alcohol support program. just try to pick the most appropriate proxy in your view, and we'll come back in about 5 or 6 minutes and discuss that. All right. I'll give people a few more seconds. But so far, everyone who's selected has selected D.
That's just one answer to so far.
Okay.
There's a few comments in the chat, Taimur. So for outcome 1, C and D. And I won't say.
Yeah.
Yep. And then impossible to choose without the perspective of the stakeholders.
Yes.
Yep. 3 more Ds and an A.
Okay, we've got some A's. Yep, you can see that. All right. Might move on to outcome 2. I'm
Yep.
going to run through the next one. So hopefully your screen is updated. So reduce social isolation. Same question. If you could just please indicate which proxy your group selected. What was most appropriate. Okay, so lots of D's and the odd A. Okay, well that's comforting because they were all, reasonably appropriate in the limited amount of information and time you had. The only one that I guess is flat out probably incorrect, and I'm glad no one's, not many people have chosen that, is C for both examples. The main difference being is C is really not from the value of the participant in the program. So it's not value to that individual in any way. So the revenue per patron in cinemas or theaters, obviously if that goes up or down, that matters to the cinema or the theater, but that doesn't really represent any value for the person. And similarly, the average cost of admission into a hospital, avoiding that or reducing that is useful for the state government or the department or the hospital itself, but it's not a great proxy for the value to the individual themselves from having improved health. So hopefully what you took away from that is, one, that it's really difficult to try and do this without this perspective of the stakeholders. And that's why I want to sort of reiterate that. But that on the other hand, there's lots of options. So this isn't, there's a lot of different ways to represent value. There's different techniques. And there's a lot of ideas out there and a lot of great research and great studies, great evaluation work, social value measurement work that you can go to and look up to get some ideas about how you might do this, and then take that to either your stakeholder group or someone you think can give you a really good perspective to help you value these things. And of course, a lot of this will become much more obvious and intuitive once you've gone through principle 1 and 2, which is actually speak to people and understand the pathway to change. That should illuminate or give you some sense of what the actual value might be. And from that, you could probably pick a relatively easy proxy. So when we do a lot of this work, people often find this to be the most, confronting or complex part of the work, but it's often the quickest and easiest part of our social value measurement once we've done all the other stuff correctly. All right, I will lock that and move on. So in this particular example, I just wanted to sort of work through that and just show what value creation might look like. So here I've got your improved health outcome and reduced social isolation for the 50 participants who've completed this program. I've then worked out and collected data that says 60% of them did experience improved health, 90% of them did experience reduced social isolation. I just happened to pick proxy D for health and proxy B for social isolation. I've got some numbers there. I then multiplied that through, and again, a simplistic way of saying, well, this program is creating $750,000 worth of social value based on those two programs, based on those two outcomes. Now, if we knew that the program cost $250,000 to run each year, we could say, well, there's a positive social return there of $3 for every dollar invested. So that represents great value for money based on these two outcomes. But is that the whole picture? Are we missing anything? Are these two outcomes the only outcomes? Is there a negative outcome? Are there other people who are benefiting or not benefiting from this program running? So we have to just think about the scope of our analysis, and that's where outcome 4 comes in. Principle 4 comes in. And principle 4 is the concept of materiality. So determining what information and evidence must be included in the accounts to give a true and fair picture, such that stakeholders can draw reasonable conclusions about impact. Now, materiality is a sort of concept borrowed from financial accounting. And the idea there is that something is material if it has the potential to affect a reader or stakeholder's decision about your project. So it is material if its inclusion or omission from the analysis will lead someone to make a different decision or will distort the picture of what's actually happening to a sort of significant degree. It's synonymous with importance, significance, but it's a little bit different, and I'll talk through it again in the next couple of slides. The main thing to remember about materiality is it's an iterative process. So you apply materiality when you first decide who to speak to. You apply materiality again as you identify which outcomes are really material and significant and need to be taken forward in your analysis. And what we want to know is how relevant and significant is the change that each of the stakeholders is experiencing. And relevance is that first filter. And here are the sort of things you think about to determine if something's relevant. So stakeholders perceive the outcome as important to them. So whether or not your program is intending to achieve an outcome, if everyone you speak to is saying, yeah, this isn't actually important to us, or it's not occurring for us, then it's just not a material outcome at this stage, no matter how much the funder or the program person would like it to be. Other things you want to consider are the organization has a policy to include the outcome, there are existing social norms that demand this particular outcome, there's research demonstrating the value of the outcome, and peers are already managing the outcome. So you might want to draw up sort of a table like that just to talk through, well, improved emotional well-being is a relevant outcome because we know that stakeholders interviewed and surveyed said this was most significant for them or relevant for them. There's a policy in place because you are a provider of housing, for example, that an integral part of that is improving emotional well-being. There's social norms around trying to improve emotional well-being. There's research that demonstrates that housing is a enabling factor for well-being. And there's other similar organizations that recognize this outcome and its relationship to housing. So that's one way to sort of systematically answer that question about relevance. The next question you want to know is, now that you've decided this outcome is relevant, is it actually significant? And you could say, well, what's the quantity or amount of each outcome? So you'd have to measure to some extent. You might want to apply a threshold. So in our alcohol support service, say we had 100 people going through, 95% of them experienced an improvement, 5% of them or 5 of them got worse. Is that significant? Is that something we want to sort of then exclude or include in our analysis and make changes to our program accordingly? And then most importantly, are there different groups of the stakeholders that have a significantly different experience of this outcome? So this is where you could apply some sort of demographic cohorts. You might say that people of a certain age or people of a particular background, people who are refugees or migrants may experience an outcome so significantly differently that if you just average out and you don't break people into segments, you will miss that outcome. So it's a really iterative process that applies through each stage of your analysis. And again, judgment calls. So something that evaluators are quite used to, but the principles hopefully allows us to get some structure and some sort of framework around some of that decision making and some of that judgment. The fifth principle that I wanted to talk through is don't overclaim. So this is sort of self-explanatory, but we should only be claiming the value of the activities that we're responsible for creating, or that the program that we're evaluating is responsible for creating. And there's 3 key questions here. would the outcomes in that social value have occurred anyway without us? So the idea of a sort of counterfactual. Has our activity resulted in a move of value, not an actual net change? So we've just moved value from one group to another. And how much of the value created is attributable back to our particular program? So the idea here is to think about what's a credible account of social value for our initiative, for the program, for the evaluand. So this is probably not too unfamiliar to people who've done some evaluation work, but I'll work through a couple of examples to show how it does apply in social value as well. So what would have happened without us? So people refer to this as the counterfactual or deadweight in sort of cost-benefit analysis terminology. So we would know that if we ran an employment readiness program with, say, 10 people, and we had an 80% success rate, that for us means that at the start of the program, there was 10 people. At the end, 8 of those people got into a job. Well, if we did a bit of research, we find out that people get into jobs without going through a particular program, if they've been on unemployment benefits and then they come off of that. And we find out that 20% of people do that anyway. So we know that 2 of our 10 would have gotten the job. So really what we should do is claim 6 of those outcomes, not all of the 8. It's just a simplified way of talking about deadweight and the counterfactual and just making it a bit more credible because often organizations will be claiming the same outcomes multiple times over. This works the other way around. So if we have, and this is quite common in education support programs, if we have an intensive education support program to disadvantaged school students to, say, improve numeracy scores, and we measure them at the start and at the end, we find there's been a 10% improvement in numeracy scores. We then look at the statewide improvement over the same period and we think, oh, well, there's been a 25% improvement. Our program doesn't look so good anymore. But if you go back to your particular cohort of students and you look at the trends, you see that they were actually going backwards. And so without the program, they would have been worse because previous years have demonstrated that the numeracy scores in that school or that district were getting worse. So really the improvement is the 10 negative plus the 10 positive, so a 20% improvement, so much closer to that statewide level. So the idea of a counterfactual or deadweight is that you'll always be an estimate. The perfect comparison would be using the same group of stakeholders that they had not been affected by the program, but we don't have any examples like that, so it'll always be an estimate. And we want to try and find information that's as close to the population as possible. So if we have the resources, we might establish a control group who doesn't receive the initiative that we're evaluating. If we don't have that, then we can at least try to gather this through our stakeholder engagement and through our data collection and some of the questions to understand what else is happening for people, what would they have done if the program wasn't available or they hadn't been able to access the program. We look at statistics and sort of trends over time to see if there's differences before and after the program started. So these are just some of the steps we take in a social value analysis to try and get as close an estimate or as accurate as estimate as we can. The second question that I brought up in terms of not overclaiming is this idea of moving value and displacement is the sort of formal term for it. It's not very applicable for most social outcomes, but it is applicable to job and employment things where programs are actually getting people into an existing job. They're not actually creating jobs. And because we know that more people apply for jobs than actually get it, if you actually put someone into an existing job, you're denying someone else that job. It's also applicable in crime, where people make a lot of, or there's a lot of investment in improving, say, street lighting in one neighborhood, and the crime just moves to the next neighborhood over. So just to talk through an example, we run a coaching program supporting small local businesses. We track it over time and we see that our revenue for those businesses that we've coached has gone up. We're extra good and we established a control group and we measure their revenue over the period and we see that it's actually stayed the same. So our program looks quite good. But then we look at the revenue of other local businesses in the area and we see that it's gone down. So really there's been no net change there. The revenue and the value has gone to our business and it's been taken away from somebody else. There's an excellent research study that came out a few months ago about the lockout laws in Sydney that looked at this exact phenomenon of displacement. So 5 or 6 years ago now, New South Wales introduced the lockout laws in Sydney in the King's Cross precinct to reduce assaults. And you can see on that graph there that there was a significant reduction right after those laws were introduced, and it's sort of been trending downward over the subsequent 5 years. Excellent result, you would think. Well, what happened to adjacent areas to King's Cross in the CBD? Not surprisingly, some of those assaults just moved and went up in those areas. And if you compare them side by side, the researchers who were evaluating the initiative and the effectiveness worked out that there were 1,300 fewer assaults in the King's Cross area, but 900 additional assaults in the adjacent areas. So the actual net change was 400. So a really great example of displacement. The third and final bit about not overclaiming is this idea of attribution or contribution. So this is something that we're all sort of intuitively familiar with as evaluations. There's lots of things happening in people's lives. A program, no matter how good it is only one aspect contributing to changes. And we need to be credible about what else is factoring into it, both because we should give credit to other organizations, other factors, family members, support networks that are helping those individuals, but also to recognize where there's limitations, where there's other things going on and that the program we're evaluating couldn't possibly contribute to changes against some of those countervailing factors. Considering who and what else contributed to some outcomes obviously helps us understand that added value and the sort of net value that we're helping create, but also helps us understand what else might be required to support stakeholders and identify other stakeholders and inputs that we've missed in our analysis. So at a really simplistic level, we might be evaluating a health service that's trying to sort of help people with healthy eating, exercising, reducing obesity. And we'll draw a little diagram saying, here's our system for this particular program. There's the service, there's local doctors and a new local gym that's opened up, and there's the family support, and all of those things contribute to whether people take up healthy eating habits, exercise more, and so on. That would be great. Now we know there's just 3 factors. In reality, we know, of course, that there's a lot of different things happening. So here's a diagram of a complex system or a system for obesity. So these are all the factors that affect obesity. You've got your psychological factors, physiological factors, biological factors, economic factors, social factors. So in reality, all programs are going to have something similar like this, and we'll have to make some judgments about how we actually determine the attribution or the contribution of the particular program. And like deadweight and counterfactuals, there's stages to this. So if we don't account for it, we're basically saying that 100% of whatever change we've evaluated and measured is because of that particular program, and that's quite obviously wrong. So it'll always be an estimate, and things we can do is try to work out what else our participants are doing or is affecting them, and that was one of the questions back in the first couple of slides about how to engage with stakeholders, is trying to understand what other things people are involved in, trying to do some quantitative research, trying to work out what people's views are of the particular program we're looking at, and looking at some existing research to give us a sense of what programs like this might be contributing if there's a longitudinal study, for example. So just to show you what we might have done using that quantitative step is that community housing example. We found out that there was 3 main outcomes: a sense of security, positive outlook for the future, and a sense of belonging. So we surveyed people before they came into the community housing project, and we surveyed them a year in. And we asked them how much change there'd been in these areas and how much they attributed back to the provider. And these are the results we found at the time. So you can see there that there's been 30% improvement in feeling safe where they live, but only half of that is due to the provider. Conversely, there's been a big change, 50% improvement in their ability to think and plan for the future, but most of that, 40% of the 50% or 80% overall, they attribute back to the community housing provider. So again, really useful data, helps us be more credible in our account of the social value that this is creating. And because it's on everyone's mind and it's a topic of conversation, and no webinar would be complete without it, I've got an example for COVID. So this links both the counterfactual, deadweight, and attribution aspects that I've been mentioning in the principle. So hopefully you can see that graph relatively clearly, or clearly enough, but there's two sets of bars there. You've got these grayish blue bars, which are the actual cases of COVID in Hubei province in China. And then you've got the orange bars, which are the reported cases. So the blue bar is when the actual infection was onset, and they found that out after the fact when they went back and they sort of looked up when the cases began. The orange bars is when the case was reported and diagnosed. So you can see there where the arrow showing that official cases started exploding around the sort of mid to late Jan. It's Jan 21st on that chart. You probably can't see that. And there was a lockdown imposed 2 days later. And at this stage, they could only see the orange bars. The authorities could not see the blue bars because they had to do that retrospectively. So they imposed a lockdown when there was an orange bar right down there at about 200 cases. But you can see that the actual cases, the blue bars, started to plummet not long after. So from this point onwards, you can start to see that decline, even though the official cases have gone up. And that sort of shows you the, I guess, yeah, the value of having that sort of data and that temporal data to tell you when something's happened and having some trends. If we look at the example in Australia, again, probably not that easy to see, especially if you're on a tablet or a phone, apologies. But here you've got Australia's diagnostic or diagnosed cases, so the actual cases that they knew at the time, but not when they actually began. And you can see all the different measures that Australia took between late February and, well, now. And if we assume the same thing, that there's a bit of a lag between when the case was onset and when it was diagnosed and reported to authorities, we might want to look at this period and say, well, what occurred then that resulted in the drop? Because we know that the peak of reported cases is probably going to be 10 or so days after the actual cases have peaked. And the blocking of arrivals from Italy, reducing gatherings, all of that sort of stuff happened in that phase. So is that something that we should then factor into our analysis? This is just early data. I just found this interesting, these two charts. I'm sure there'll be months and years ahead of social science analysis about COVID and the different measures that were taken. All right. The last two principles I'll run through fairly quickly because they're not, they're fairly obvious and don't require too much explanation. But principle 6 is being transparent. So trying to be accurate and honest and show what was done. Given that you'll have noticed there's a lot of subjective decisions and judgments that are being made throughout social value analysis, it's important to be transparent. The easiest way to do that is obviously to include as much as you can. So I've just pulled out a table of contents that I think is a good example, which talks about the consultation, because that's the critical, key part of this, consulting your stakeholders, principle 1. A good report will say who you consulted, why you did it, and in what ways. Down the bottom there, it also might identify the verification process. So how did you actually review and check and test your judgments and your decision making? It might include the materiality test that you applied, and it'll include the actual model or the values that you used. So who did you engage? You might have a table like this. This is just an example. All the different people, why you included them in your analysis or why you excluded them with a bit of a rationale. You might then go forward and also talk about how you verified it. So if you did some sort of formal verification, or if you presented them to say a reference group or an AGM, how did you basically test and validate the decisions that you were making through your stages of the social value analysis? And then, of course, if you've got evaluation there and you have a model that you put together, you'll want to show that model. And again, this is taken from the back of a report. I don't expect you to read that all, but this is every single value for every single outcome for every single stakeholder was included as an appendix, so someone can go back and check how those figures came to it. So it's not just some black box that people pulled out the value from. And just to zoom in, if you can see that, that's just one line in that table. So it talks about that improved emotional well-being outcome, the number of people who experienced the change, the financial proxy that was used to value it, the amount of that change going forward, what they did with the counterfactual value, the deadweight value, the attribution value, the level of displacement, etc. The last thing I want to quickly talk about in transparency, because I think this is a really important thing that maybe doesn't get used enough in social value analysis, is the idea of a sensitivity analysis. Because if you have a quantitative model, one of the great things you can do is to play around with that, test your judgments, test your assumptions, and be transparent about that so that people get a sense of, well, what if we chosen, proxy B instead of proxy C for that outcome? So just to talk you through that, our alcohol support program, as I showed earlier, had a social value of $755,000 and a ratio of $3 for every dollar invested in running that program. Now, what if we tried a couple of different assumptions? What if we doubled the participants without changing the cost of running the program? Well, then the ratio would double because none of the costs have changed. Similarly, if we doubled the cost of running the program without changing the number of people, we would halve the ratio. If we changed the proxies, we would change it a little bit either way. If we decided that half of those participants would have had the improved health program even without the program, health outcome without the program, we could see the ratio would drop. So playing around with this is a really good way of validating for yourself that the assumptions you've made and the steps you've taken are right, but also demonstrates to people that that you've taken into account what might happen in your model and gives them a sort of a sense of how well you've tried these different assumptions. All right, lastly, principle 7, verify the result. So Social Value International has a formal process for assessing social value reports. They have an assurance standard that you can complete beforehand. They have something called a pre-report assurance outcomes check service. And they have a full report assurance, and they give you a nice pretty statement at the end of it. This obviously costs a bit of money. It's not always required, but at the minimum, what I would suggest or recommend that you should be testing your judgments with the program stakeholders throughout as much as you can. Seek out a peer review, establish a steering group or reference group that can give you some guidance, because this is a sort of judgment-laden process, and it's a great thing to do is just to sort of verify your steps as you're going through it. So just to sort of wrap up, I guess, you've got the 7 principles. I've gone through them, probably some in more detail than others. But I just want to make clear that these are principles, they're universal, and they can be applied in different circumstances. But they will be challenging sometimes as a practitioner, but often also for program you're evaluating and the program managers, because they are designed to make this otherwise invisible value visible. And we know that sometimes that value can be invisible because it relates to outcomes experienced by people who don't have much power in decision making. But what it does do is help make organizations more accountable for what happens as a result of their work, beyond whether they have achieved their intended objectives. So it's really trying to work out what matters to the stakeholders of the program and giving that some relative importance, and not just what a program is seeking to influence or achieve. And lastly, once you do this whole process, that's not the end of the story. That's not the objective. The whole idea of valuing social outcomes and determining some relative importance is to have the means to make a more informed decision and have a more informed conversation with people in positions of decision-making power about the decisions we need to take to improve the value of programs. If you'd like further information, as I mentioned, Social Value International are the sort of the governing body for all of this. They've got some excellent guidance documents and videos on their website. They've got some standards for applying the principles. They've got the webinars in case you want to watch somebody else do the same thing. And they've got some brief technical papers on how the social value principles link with some other initiatives like the Sustainable Development Goals, benefit corporation assessments, the Natural Capital Framework, etc. So yeah, we're getting close to time, so I'm just going to wrap up quickly. We've got the 7 principles of social value there. And before I get to the questions, or as I let you have a chance to just put in some questions in the chat, I'd love for you to fill out the survey we had at the start again, just to get a sense now that you've actually understood some of those principles, or at least know a little bit more. Which of these principles do you consider apply in your work regularly? So please go back to that link and just fill that in, and as well just put some questions in the chat, and I'll try to get to those. All right, it's a little bit different from the first time around. And sorry, I promise this is the last poll style question, but I wouldn't be a good evaluator if I didn't ask this last one, which is, now that you've actually heard from me, do you think learning about these social value principles will help you with your evaluation work? All right. I might stop there, and I'll get to the end of the presentation as well. And I will stop sharing my screen so that I can check out the chat.
Great. Thank you very much, Taimur, for the very thorough presentation of the 7 principles. So I think everyone probably came in wondering what we had learned tonight, and then stepping through the 7 principles really logically, I think has given us a good understanding of the thorough method to valuing, essentially, that evaluators can consider, and potentially quantifying those values. So I think that was really insightful. And if we're talking about unpacking the black boxes as evaluators, this does it in a very transparent way, albeit looks quite methodologically rigorous and robust, and probably takes a lot of time as a practitioner. Do you have any reflections on that, the process of working through all of these assumptions and how it really works as a practitioner?
Yeah, I mean, I think, obviously if you lay it out here, and it's always difficult with a sort of speaking to a screen and doing this over an hour, but it seems like a lot of different steps that you have to take sequentially, and lots of different things you have to factor in. But when we do our work, this sort of becomes second nature, and you sort of think about these questions, and you think about trying to get the answers to these right at the start in your planning stage. And as anyone who's done even a moderately complex evaluation, you know how important that planning stage is and how important that scoping stage is. So adding these few little bits and pieces, I don't think the social value principles are that much different to what most evaluators do anyway. But just having these extra few steps or things at the back of your mind helps you with that stakeholder engagement, and helps you just add a few questions in to the program managers as well about why are you doing this, what are you trying to get out of this, and then building that through to produce an account of social value.
All right, great. There's one question on the chat. So it says, some years ago, a lot of people were talking about social return on investment. Would you say this is the same thing?
Yeah, so Renee, thanks for the question. I think social return on investment is a methodology, or sort of an approach. And the principles of social return on investment, again, because it was this principles-based approach that grew out of this idea that cost-benefit analysis were missing something, those principles are reflected in the principles of social value. So the distinction I would make is that social value principles are about a way of guiding judgments around measuring social value, whereas social return on investment is, I suppose, the methodology for applying those.
Do you often end up with dollar values or financial values through the social value method?
Yeah, we often do. So we often do it for calibration, comparison, communication purposes. So a lot of organizations find that it is a powerful way to communicate back to funders who might sort of think, well, this program is very cost intensive, and you're only working with 10 people. You know, what can we do to sort of save costs, or can we work with 50 people? But once you start to show that actually those 10 people, the outcome you're creating for them is worth, a lot. It starts to help calibrate that conversation, but it's not the end all of the social value measurement. So as I said, you often get some really rich, important, useful data for communication, for program improvement, and to understand where and how you're creating change and where and how you can improve. And you don't need to go that extra step of turning that into a dollar value if it's for internal purposes.
Does anyone else have a question they want to either speak out or write into the chat? If not, and while we wait for any to pop in, I mean, how do you deal with situations where different stakeholders, even from the same cohort, have quite different views about what they value?
Yeah, so that's where that segmentation becomes really important, and it's an iterative process. Like you might have to do it 1 or 2 times, where you might find there's one particular person who just stands out, but the other 99 are sort of common. And so you might just say, again, from a materiality perspective, it's not material to try and incorporate that one person's view. Other times you might find that there's particular characteristics, there's particular vulnerabilities or strengths about people that mean that they're experiencing an outcome in a completely different way, and you need to hive them off from your analysis. And we often do that. We often talk about, if you've got a stakeholder group where you've got parents or you've got people who are looking for employment, you might hive off the people who have particular disadvantages or particular strengths and say that they are a separate stakeholder group. We're going to give them a different financial proxy because of everything we've heard from them about the value of that outcome.
Okay. Question from Eddie. So how do the governments, or how does government and the funder or the funder regard these social value evidence as compared to other cost or quantitative evidence?
Yeah, good question, Eddie. So I think, it's certainly one of those things where the emphasis is still on trying to get those unit costs. So, not to sort of malign the intents of anyone, but a lot of organizations want to be able to demonstrate to a funder, if it's a state government department or federal department or anyone, that we are saving you actual money. We are reducing people coming into the emergency department. We are reducing people who are, on unemployment benefits. And that's fine. That's an important part of it. But being able to sort of communicate these additional social outcomes in the same language that funders are used to is something I think funders are much more comfortable with now than they were 5 or 10 years ago. There was a tendency to sort of put that in a cost-benefit analysis to say, yes, there's been some improved social outcomes. They're X. They're not, we're not going to put a value on them. And if you think about the idea of a well-being economy, which is starting to take up, get a lot of traction, and as New Zealand's trying to implement that, this idea of broadening out GDP and measures of the well-being of an economy, then that's where this becomes more powerful.
Another question from Stephen Cuttress. So I'm wondering if there's any relation between measuring social value and measuring social capital. What would be the merit of these approaches?
So if I've understood social capital as being sort of part of the sort of 5 capitals framework that gets used, Stephen, if that's how you intended it, There's definitely some overlap and some linkages, and I commend the paper on the Social Value International website that links social value principles and social capital measurement. That might go into that a little bit more. I'm probably not as familiar with that.
Great. All right, we're nearly out of time, so I think there is a spot on Zoom to give a reaction. So I'd like to just give a big clap to Taimur. So thank you for tonight's presentation. Very well delivered. Some great feedback coming through on the chat. Really clear presentation of the method, and thanks for taking the time to prepare and share some of that. And I'm sure you're available for engagements in this area. It's just a method that we can all draw on, keep in mind, and add to our value-based analysis when we come to that element of evaluation. So thank you very much.
Yeah, no, thank you, Charlie, for hosting, and thank you everyone for spending your evening with us. Really appreciate it. And yeah, please obviously get in touch if I can provide you any further information. Enjoy the rest of your weeks.
Great. Thanks, everyone. And we'll see you next time.